My name is David Jewell, and I live in New Milford, Connecticut. I'm 58 years old. Now let that muscle grab. Try to be straight on your trunk.
David Jewell has spent several decades working as a physical therapist.
Let's take it out and hold it. Let's do the hold.
Much of his work focuses on rehabbing joint replacement patients.
And a little incline. Good.
David just never imagined he would become one of those patients.
I began to experience pain in the hip, in the groin in particular, and especially at night. I remember it burned like fire, and I thought, oh no, what do I got going on?
He first felt pain in his hips a decade ago. It subsided for a few years, but eventually came back on his left side. An MRI confirmed advanced osteoarthritis. Anti-inflammatory medications worked for a while, but in 2008, it became clear to David that hip replacement was his best option.
I had been working, with Dr. Devaney for a number of years, and I had watched the evolution in hip replacement surgery. I'd worked with his patients, I'd worked with him, so I knew what the outcome could be.
An outcome that was pain-free.
I was operated upon on a Wednesday. I mobilized. I started using a cane on Thursday. I went home on Friday with a cane.
5 days later, he was getting in and out of bed on his own. And 8 days after his surgery, he was back at work. Now, he says his left hip is as good as new, but the pain is back on the right side. Simple tasks such as bending down to pick up a pen and putting on his socks are major obstacles.
Every single step that I take, I have pain in my groin, on the side of the hip, and now in my back.
So, in 1 week, he'll do it all over again, having his right hip replaced.
Can't wait till next Wednesday. I'm absolutely positively looking forward to taking that first step when I get out of bed, because the pain's gone.
This is David Jewell, 2.5 weeks after hip replacement surgery. Raking, walking, and climbing stairs with few problems. He can hardly hold back the enthusiasm for how he's feeling.
If I were to say fantastic, that would probably be pretty close. The pain that I have now at 2.5 weeks post-op is totally different. I no longer have the weight-bearing pain that was the reason why I chose to have the surgery. That is absolutely gone.
David was ready to come home from the hospital the day after surgery and initially needed help getting out of bed. Fast forward 2 weeks and he's already getting up without assistance. He's relied on his professional experience as a physical therapist to move along his progress. Several times a day, he completes various exercises. Initially, a simple piece of cardboard helped with the process.
Looking back on records that I kept from my first surgery, I'm about a week ahead as far as the reduction of swelling. Again, the pain was gone immediately.
He still has some limitations, such as bending forward. As a result, he must still use a sock aid. Also, everything he sits on must be elevated, including in the bathroom.
The restrictions that I have right now are basically comfort limiting.
Now, he's just looking forward to the time when his body is completely healed and he can resume the type of life he wants.
The decision to have this hip replaced, now I can move ahead and to the things that I want to do in terms of my life. I led a very active lifestyle before my hips began to give me problems, and I want to get that back, yes.
Six weeks post-surgery, David Jewell is flying through exercises at physical therapy. He's his own physical therapist, and he has the benefit of years of experience working with other hip replacement patients.
About a week ago, I went dancing. We were at a Christmas party, and I was able to do some good dancing. I was able to do cha-cha, I was able to do a little swing, I was able to do electric slide. I mean, it was a lot of fun. And my hip felt absolutely terrific.
Oh, hey, Dave.
Dr. Robert Devaney is also pleased with David's progress.
Any problems there?
No, just the tightness.
Danbury Orthopedic Associates has a long history of delivering top results for patients. The practice is the oldest orthopedic group in the area, performs replacements on all joints, not just hips, and has 5 locations. When it comes to hip replacement outcomes, Dr. Devaney says David's right on track.
This is what people can expect. David's recovery is a little bit quicker than some other patients. I've had a large number of patients who recover as quickly as David.
And the number of patients needing hip replacements is growing.
If you look back 20 or 30 years, perhaps as far as 30 years ago, it was more frequently reserved for older patients. And today, with the changes in technology and the techniques that we have available, there is really no usual age any longer. Okay, Dave, I can ask you just to walk at a comfortable pace, and I'll follow you.
Dr. Devaney is a fellowship-trained specialist in hip and knee replacement surgery. He says patients range in age from 30 to 90. The new replacements also last a lot longer. Dr. Devaney believes a modern-day hip replacement may be viable for 30, even 40 years.
Patients should not rule out the possibility of replacement for relief of their pain based on age or activity level or other medical conditions.
As for David, he still has some sensitivity in his incision area. Otherwise, he feels like a new person.
I'm a happy patient. I'm very satisfied with where I am at this time, post-operatively 6 weeks.
Now, 12 weeks since his surgery, the pain that once plagued David Jewell is a hazy memory.
I don't have any pain. I mean, I can do what I want to do.
He remains cautious in his movements, but take a look at the difference. Bending down, climbing stairs, and getting into the car are now maneuvered with ease rather than agony.
Patients should expect to basically have no more pain once the healing process is complete. And I think that David's experience is very representative of what most total hip replacement patients should see.
Dr. John Dunleavy is one of the fellowship-trained orthopedic surgeons at Danbury Orthopedics. As in David's case, this surgery is intended to move people forward rather than slow them down.
I think a person should really be able to do almost anything that they were able to do before, with the possible exceptions of some contact type sports.
Also uplifting, the news that these joint replacements are lasting much longer.
And this has also improved dramatically even over the last decade or so. 10 years ago, if asked that question, I would have said probably between 10 and 15 years. 5 years ago, I would have said 15 to 20, and now we're saying 20 to 30.
As a physical therapist, David followed the advice he often gives other patients, like staying on schedule with exercises. It served him well.
The more I do it, the easier it gets. And that's where you are at 3 months post-op. You can do these types of things.
He just wishes he made the decision sooner to have the surgery.
Looking back now and seeing how successful the surgeries both were, I would, if doing it all over again, I would not have delayed.
Now his sights are set on a very active future.
It's great to be back and feel that you can get back to enjoying your life. I'm an outdoors person. That part of my life has been restored. And so everything's working out very, very well.